You are now on the inside of HHS. You were a hospital administrator, you were a doc. What's it like to be on the inside when you pull back that veil? How is it different?
Yeah, Chris, thank you for that question. You know, I've been a part of the healthcare landscape in North Carolina for over 20 years, and I've had different sorts of interaction with HHS. As a doctor, I got to see what it meant for my patients to get Medicaid that previously didn't have Medicaid, and then certainly many of the human services. What I've been most impressed by, and maybe shouldn't be so surprised by, has been the people who work for the agency. We got a remarkable group of individuals who are committed to the work that they're doing. Earlier you were talking about labor shortages with the other guests. We're facing some of that as well. So I am really impressed with the number of people in the agency who come to work day in and day out in service to the 11 million people of this state.
You've got, and you had mentioned in a recent interview, Your Honor, that there was 20 to 23% openings of jobs, postings within the agency. Is that a liability? Is that punitive to you?
It's not punitive, but it does create challenges because when you do have that 23% vacancy rate, you have to make priorities. And our priorities have really been to make sure we put people first, to make sure we're serving those who are most in need of of the services we provide. But it is a challenge. And we're mostly seeing that in our state-run facilities. It might surprise many people, but we actually run hospitals in North Carolina. We have about 10 treatment facilities as well. And those areas where we directly take care of patients is where we face the greatest labor challenges.
Carl, question?
Hey, thank you. Nice to meet you, Mr. Secretary. Looking out years, we're seeing so much automation. AI is just really in a stratospheric growth mode here. Where do you see healthcare, and how can AI help you run a large system, but what's the impact it has on access to healthcare?
Absolutely. That's a great question. Thank you, Carl. As a bureaucracy, as an agency, and one that provides healthcare services, there is so much administrative burden, and there's a real opportunity for responsible AI to help us de-burden individuals who are on the front line, so that if you have capacity, you can optimize the use of that capacity. There's an opportunity to think about automation with respect to some of the work that we do around enrollment and many of the other things that we do. So as we have that labor shortage, as we have that vacancy rate, I'm optimistic that we can use technology tools to help close some of that gap.
Does that help,
No, please.
Does that help from managing the roles of who's on Medicaid in North Carolina and South Carolina?
It could. You know, right now that process is still very manual, determining who's eligible, making sure that those who are eligible continue to tap into those benefits. But as we've seen, AI has so much potential and possibility. I'm really optimistic that it can help not only on the clinical side and the services side, but those back office administrative functions as well.
Right.